Good evening. I'd like to welcome everyone to Crawford County Memorial Hospital's virtual town hall. I am Heather Rasmussen. I'm the Executive Director of Care Integration at CCMH. And with that, my role also includes serving as the infection preventionist at CCMH as well as the quality director. With me is an amazing list of panelists who are going to discuss the latest information and updates of the COVID-19 pandemic. I'm very honored to introduce every one of our panelists, and we'll start with Dr. Wright. Dr. Wright is the Chief Medical Officer for Infection Control at Crawford County Memorial Hospital. He is a graduate of the University of Osteopathic Medicine and Health Sciences and College of Osteopathic Medicine and Surgery in Des Moines. He is a fellow of the American College of Osteopathic Surgeons, and Dr. Wright is also board certified by the American Osteopathic Board of Surgery. So when I introduce you guys, if you could just please give a wave so we know who you are, Dr. Wright. Our next panelist is Dr. John Lothrop. Dr. Lothrop is the Chief of Medical Staff at CCMH. He is a native of Nebraska and completed his family medicine residency at the Swedish American Hospital, and he is board eligible from the American Board of Family Medicine. And we have Dr. Elizabeth Libby Raniger. Dr. Raniger specializes in pediatric medicine at CCMH, and she is board certified physician. She is a graduate of the University of Virginia School of Medicine in Charlottesville, Virginia, and completed her pediatric residency at the McGaw Medical Center at Northwestern University in Chicago, Illinois. Also joining us is Kim Finneran from Crawford County Home Health Hospice and Public Health. Kim is the Crawford County Public Health Director. She's been in her position at Public Health for 12 years, and she received her Bachelor of Science in Nursing at Briarcliff University. And last but certainly not least, we have Greg Miller. Greg is the Director of Crawford County Emergency Management, and he has been in that role since 1992. I'd like to thank the panelists for being here today to talk about COVID-19. I know each one of them has been working very hard on and extremely hard during this pandemic, and I'm thankful that they took time out of their busy schedules to be with us today. I'd also like to take this opportunity to thank our providers, our nurses, CNAs, lab staff, radiology staff, rehab staff, dietary staff, materials management staff, environmental services staff. I mean, the list is ongoing, for your dedication to our community during the pandemic. Your service and devotion to our community has been outstanding, and we all appreciate the hard work each one of you has been doing every single day. So with that, we'll get started. So we have a list of questions compiled from our community, and I will direct a question to a panelist and ask them to answer. So the first question is actually for me as an infection preventionist at CCMH, and the question is it safe to come to CCMH for routine medical care or surgery, and should I be concerned about catching COVID-19 if I do? So really you should feel very confident that CCMH is a safe environment. We began our mitigation efforts at the earliest sign of the pandemic in early March. For 8 months, we've been limiting visitors. We've been providing proper PPE or personal protective equipment for our caregivers. We have been cleaning and disinfecting. We've been practicing social distancing. We've all been wearing masks. We've been screening patients. We'll continue to screen our patients and our caregivers upon the entrance of our facility. We also continue to make sure that our facility is safe, that our waiting areas are safe, and we are constantly reviewing and updating our safety practices as needed. So should you be concerned about catching? So when the concern about catching COVID-19 encourages people in the community to social distance, that's healthy. But when those fears drive people away from getting the care that they need at hospitals and clinics, that's when it becomes dangerous. So I think the message is pretty clear that Crawford County Memorial Hospital is safe, and if you need to seek health care, you should, and you shouldn't wait. So the next question is for Kim Finneran. Kim, vaccines are being developed and may be available soon. How will the vaccine work, and when could I reasonably expect the vaccine to be available to me and my family?
We anticipate an emergency use authorization to be issued by the Food and Drug Administration, or FDA, in response to the public health emergency before the end of the year. Right now, the Advisory Committee on Emergency Practices, which is part of the Centers for Disease Control and Prevention, or CDC, is working to determine the initial priority groups who will be eligible to receive the vaccine when it becomes available. This committee is in the process of developing a priority list, and while the definite populations have not been released yet, we do expect that long-term care facility residents and workers will be among the top priority groups, as well as other healthcare workers, emergency service providers, law enforcement. And as more vaccine becomes available, the priority groups will be expanded to eventually be available to the general public. And depending on the completion of trials and manufacture of the vaccine proceeding on its current schedule, we anticipate that the vaccine will be widely available for everyone sometime next spring. The vaccines that are most likely to be available first require 2 doses, one of them 21 days between and the other with 28 days between. The vaccines are not interchangeable, meaning that both doses must be from the same vaccine, and it can take up to 2 weeks after receiving the second dose for your body to develop its full immunity.
Okay, and the next question is also to you as well, Kim. I have been told by others that once you have COVID-19, you're immune. Can you catch COVID-19 more than once?
Well, the immune response, including the duration of immunity, is not fully understood yet. If our bodies treat the virus like influenza, immunity might only last a few months, and people who are immunocompromised may not ever develop immunity. And there are studies being done to track this, but until more data is available, it's difficult to state a definite length of time. Our best answer is to continue preventative activities like staying home if you're sick, washing your hands, covering coughs and sneezes, limiting contact with larger groups, distancing, wearing a mask, especially if you're unable to distance, and following isolation and quarantine guidelines. And if we are all doing all of these preventive things, that does reduce everyone's risk of contracting the coronavirus.
So you also mentioned influenza. We've been in such a COVID world lately that the question comes up, should I get a flu shot this year?
Everyone aged 6 months and over should get a flu shot every year. It's especially important this year with both viruses circulating at the same time. The flu vaccine won't prevent you from getting COVID-19, but it can reduce your risk of getting the flu. And because COVID is a new virus, we aren't sure yet how the viruses are going to interact. And all illnesses put stress on the body, which can lead to other infectious agents taking advantage of our weakened states. And these put us at higher risk for more serious complications should you become infected with either of the viruses.
The next question is for Dr. Wright. Dr. Wright, hospitalizations are on the rise, and some hospitals in Iowa and other states are being overwhelmed with COVID-19 cases. Should I be concerned about having a hospital bed available if I or a loved one was needing to be hospitalized?
Well, that's a concern we all have here at the hospital and in hospitals around the state and in the region. We have contingency plans in place both locally and throughout the state to help with expanding the availability of hospital beds. Also, we're working with the local community as well as our local region and throughout the state to communicate and to cooperate to make sure that hospital beds are available. It is a concern, of course, as the numbers continue to spike. However, as of now, as I said, we had plans in place, and we're sitting pretty good right now.
Kim, several questions are coming to you. So we hear a lot about community spread. What does that mean? What does community spread mean?
Sorry, I forgot to unmute myself. Community spread is when individuals who are infected with the virus aren't sure where or how they were infected.
So what's the difference between quarantine and isolation?
Well, quarantine separates and restricts the movement of people who were exposed to a contagious disease during the time that we were waiting for them to see if they develop symptoms. Isolation separates people who have a contagious disease from people who are not sick. And both of these measures help reduce the spread of contagious diseases.
Okay, so how does this work with a household where some family members have COVID and others do not?
For all exposures or close contacts, the quarantine period is 14 days from the date of last exposure. Quarantine within a household is handled a bit differently than a specific exposure event, such as riding in a car with someone who then becomes ill or tests positive. In the household, the exposure is ongoing because you live with the person. So the positive person is considered contagious until at least 10 days after their symptoms started. And if they don't have symptoms, that would be the date of their test, and they are fever-free for 24 hours. So day 10 for the positive person is day 0 for the other members of the household. You then begin counting those 14 days, and this is the time that the household members are to quarantine. In general terms, it usually ends up being around 24 days. But if during this time frame another member of the household tests positive, the clock for the other members restarts. It gets a little complicated.
It sounds like it. So if I test positive and I'm considered to be an essential employee, what does that mean for me? Should I treat a positive test differently as an essential worker?
Well, quarantine is still 14 days from the date of last contact, but you are allowed to work as long as additional precautions are taken. You still must quarantine at home when you're not at work. And if during this time the person develops symptoms, they have to leave work immediately and consult with their healthcare provider to determine the best course of action. Should testing be a part of that plan, if they test positive, they're held to those same isolation rules as every other positive person, which is 10 days from symptom onset, fever-free for 24 hours without the use of fever-reducing medication, and improved symptoms.
Okay, and again, we're at CCMH's virtual town hall meeting tonight. I'm Heather Rasmussen, and our panelists are Kim Finneran from Crawford County Public Health, Dr. Wright, Dr. Lothrop, Dr. Raniger, and Greg Miller. So this next question is for Dr. Lothrop. Dr. Lothrop, how does COVID-19 testing work?
Currently at CCMH, we have 3 different types of tests. They're a nasal swab about the size of a Q-tip that we stick about an inch or inch and a half into each nostril, and we spin it a few times. Depending on different circumstances, we choose one test or another.
Okay, so why does it take so long to get my test result back?
Early on, we didn't have the machines to actually run the tests. They were being sent either to Omaha or Des Moines to the state labs, and those labs were just overwhelmed with the test samples. And so early on, it took 5 to 7 days to get back. Now we're doing pretty good with the ones we have to send out. They're taking about 24 to 48 hours. We do have some rapid tests here in-house that we can get done in 15 minutes to an hour as well. So the turnaround time has significantly improved here over the last month, especially.
Okay, so the reliability of testing for COVID-19, especially the rapid testing, has been called into question. How reliable are the tests, and how do you know if your positive test is truly a positive test and your negative test is truly negative?
Okay. The rapid test, I confirmed with the lab today, and they confirmed with the manufacturers. The data they're putting out is saying that they're 98, 99% sensitive. The thing that I guess the physicians are a little worried about is the sample size of those tests is very low. Usually they do these testings on tens of thousands of people, and the rapid test was done on a couple hundred people, and so sometimes we question the results of it. So if we do get a negative test on the rapid one, but we believe that more than likely you are a positive or your symptoms are consistent with a coronavirus or COVID infection, we usually go on and we do the P lab, the one that we send out to the state. As far as how sure are we that they're positive, Again, like I said, all three of our tests are 98 to 99% sensitive. So that means about 1 in 50 or 1 in 50 or 2 in 100 people will come back and, the test would be inaccurate for. And so when we're testing a couple hundred people a week, we can't expect to have, a couple false negatives. And so that's the same thing with the influenzas and the strep throats. The sensitivity is right along with those.
Okay, and in the news, we've heard about antibody testing. So can I get an antibody test? And if I do, and the result comes back positive, what does that mean?
So you can get an antibody test. What happens when you get the virus, your body produces antibodies to fight it off. Those antibodies start to show up sometime over the course of 1 to 2 weeks, and we're not exactly sure how long they last. There are 2 different antibodies that we're looking at. One is the acute antibody, and that says you actively have the disease process, and then that one wears off over a short period of time. And then there's a chronic antibody that we don't know exactly how long it lasts, somewhere around 3 months more than likely, and it can last longer. And so let's say you do the antibody test and the acute one shows up, but the chronic one doesn't, then that means you're really early on in the disease process. If they both show up, you're somewhere in the middle. And then if we do the antibody test and the acute one's gone and the chronic one's there, then that means more than likely you had the disease process several weeks ago. And we do have it here, and I believe it's somewhere around $100 or $150. I don't know the exact cost, but it is something that we sure can do for you.
Thank you, Dr. Lothrop. Kim, some questions for you. Can you please explain contact tracing and how that works?
As with all with reportable infectious disease, there is an investigation process that involves contacting the infected individuals. And part of this investigation includes asking about others who they may have exposed to the disease. And this is the contact tracing that you hear a lot about. Contact tracing, isolation, and quarantine are not punitive actions. Instead, they're meant to reduce the spread of the virus in the community, reduce illness and deaths, and minimize the impacts to our healthcare system. And it's very, very important that individuals let public health know about these exposures or contacts, because that just helps us to be able to accomplish those goals.
So what should I do while waiting for my COVID-19 test results?
If you've been tested for COVID-19 because you have symptoms or because you were exposed to someone else who tested positive or who has symptoms, please quarantine at home until you receive your test results.
What about wearing a face mask?
Face masks, along with all the other public health measures that are available, do help reduce the spread of disease. Using all of these measures in combination with each other really makes the biggest impact for everybody. And many of these measures should be in place all the time, regardless of a pandemic response. They include things like staying home if you're sick, washing your hands often with soap and water, and if soap and water aren't available, using hand sanitizer, avoiding touching your eyes, nose, and mouth, covering your coughs and sneezes with a tissue or the inside of your elbow, putting at least 6 feet of distance between yourself and people who don't live in your household. And this is especially important for those who are at higher risk of developing serious complications. And again, wearing that mask in public settings, especially if maintaining distance is difficult. But it's important to remember that the mask is not a substitution for distancing. Making sure that you're cleaning and disinfecting frequently touched surfaces often, and monitoring your own health status and maintaining contact with your health provider if you're symptomatic. And then finally, determining your own risk level and deciding what activities you can participate in based on your own risk level.
Okay, so the next question is, I don't want my friends to be mad at me if I test positive and they have to isolate and quarantine because of me. So do I really have to disclose their information to public health as an exposed contact?
Again, it's really, really important for us to be able to contact everybody to let them know that they've been exposed to help minimize the impacts to our community, both in the illness end of things and, the risk of overwhelming our healthcare system. And again, they're not punitive actions. The contact tracing, the isolation and quarantine are really meant to reduce the impacts of disease on our community.
Thank you. And Dr. Aniger, the next couple questions are for you. So how does COVID-19 affect small children?
So most kids that we've seen have mild symptoms and some have no symptoms at all. However, that doesn't mean that some children don't get severe illness, especially kids under the age of 1 or kids with underlying medical problems similar to the older adults can have more severe disease. In terms of symptoms, kids get very similar symptoms to adults. And some data has shown that kids actually present with single symptoms more commonly than adults. For instance, kids can come in with just fevers and be diagnosed with COVID, or just cough. And that can still be their main presentation.
So are children more likely to catch COVID from another child or from an adult?
It's been shown that kids have a higher viral load or a higher level of the virus in their nostrils, basically in their droplets. But no one knows whether that technically means that they're more contagious or more easily transmitting the illness to others. So it has been shown a little bit that younger kids are less likely than older ones to transmit to others. The older you get, the more likely the transmission is. So getting it from an older child is probably more likely than from a younger one.
What is the risk of my child becoming sick with COVID-19?
Obviously, most kids have mild symptoms, mild to moderate symptoms. Some kids have none. But there are kids that have very severe illness as well, especially those that we talked about initially. Obviously hospitalization is a risk. Being out of school, missing all of that stuff is a risk. The one that most people are asking about right now is the MIS-C, or multi-system inflammatory syndrome in children. And a lot of parents will ask about this because it was on the news a ton. Fortunately, this is a very rare thing that happens to kids who have had COVID. Very, very rare. So this is not something that we're seeing at all or a lot out here. But that is obviously a complication that could potentially happen if your kid had COVID.
Should children wear masks?
100% yes. That being said, any kids under 2 should absolutely not be wearing a mask just due to suffocation risk. They're not able to remove the mask on their own typically at that age. So we don't recommend them under 2, but any kids over 2 should definitely be wearing a mask. And masks appear to be quite effective, as Kim was talking about, in preventing transmission of COVID-19 due to droplet contacts, basically. And it basically can help you or your child from getting COVID-19, but it can also help them from asymptomatically transmitting COVID-19 to someone else when you don't know that they've had it. So it's a beneficial thing for all parties. And yes, we recommend the masks highly in children as well, over the age of 2.
Okay, thank you, Dr. Aniger. And Greg, the next question is for you. Early on in the pandemic, we heard about personal protective equipment, or PPE, shortages for hospitals and medical professionals. Is PPE still in short supply?
PPE is still in short supply. Amazon is a place to try to get some. If you guys need any, or the nurses need any, or the schools need any, I just got some youth masks for the school. I go through the state of Iowa and get them. That's my best way to getting them. Otherwise, I've tried to get them through Amazon, and it's almost impossible to get them. But they are available. It just takes time, because most of them are not made in the USA, and they have to go through process to get them here.
Okay. All right. And our last question that we have for the evening goes to Dr. Wright. Dr. Wright, why do the guidelines for COVID-19 keep changing? It's hard to keep up with the latest information.
It is. It's hard for us to keep up with it too. It's a new virus. And as we learn more and more about this disease, recommendations for treatment, recommendations change. And studies are being done all the time. So we've essentially had this for less than a year, we think, maybe a little bit longer. And every major organization now, university, are involved in studies, and as these things come out and we learn more and more about the virus, the recommendations change, and as well as treatment, and with vaccinations coming around and everything. So that's why it's a new thing. We've not seen it before, and we're learning more and new things essentially almost every day.
Right. Any other thoughts about COVID-19 from our panelists before we wrap it up? Okay, so this wraps up our virtual town hall. I'd like to thank our group of panelists again for talking with us this evening. We all know COVID-19 has been at the forefront of our world for the last several months, and it truly helped to have such an exemplary panel walk us through some of our questions. So if you continue to have questions or concerns about COVID-19, I would encourage you to reach out to your provider or to public health. There are also numerous COVID-19 resources on the web from experts such as the Centers for Disease Control and Prevention, or the CDC, from the Iowa Department of Public Health. So thank you to everyone who watched our town hall this evening, and everyone stay safe and healthy. Thank you.
Thank you.
Thank you.